Everyone, today I'll be doing a brief video on brain anatomy and brain bleeds for nurses. First, I'll start with the layers. So we've got the skin, the periosteum, and the skull, which are the protective physical outer layers. Then we have the cranial meninges. The epidural space, this is between the skull and the dura, and it contains meningeal arteries and veins. We've got the dura mater, which is a tough outer layer. The subdural space, the arachnoid matter, this is soft and spongy. Then we've got the subarachnoid space. This is where cerebral spinal fluid circulates. The pia mater, and this directly surrounds the brain and contains blood vessels that travel into the brain. The meninges surround the brain as well as the spinal cord, and they function to protect the brain from injury by compartmentalizing the cerebral contents. They also protect it from infection by means of the blood-brain barrier. Cerebral spinal fluid functions to surround all exposed surfaces of the central nervous system. It interchanges interstitial fluid of the brain, cushion structures, supports the brain, transports nutrients, chemical messengers, and waste. Too much spinal fluid can cause hydrocephalus and intracranial hypertension, and too little, for example, a spinal cord leak, can cause intracranial hypotension. Cerebral spinal fluid is created by the choroid plexus. This is brain tissue that lines the ventricles, and we make approximately 500 milliliters of CSF a day. Normal adults have about 100 to 150 milliliters of cerebral spinal fluid in circulation, and we produce about 20 mils of it each hour. Sometimes you'll see patients with lumbar drains on the floor. These are typically drained every hour, and you'll typically see orders of about 10 to 15 mils of cerebral spinal fluid that we are draining. So the brain contains 4 ventricles, the right and left lateral ventricles, the third ventricle, and the fourth ventricle. Then we also have the central canal of the spinal cord. This is a continuation of the ventricular system of the brain. It runs the entire length of the spinal cord and contains spinal fluid. CSF starts in the lateral ventricles, then it continues to the third ventricle, the fourth ventricle, into the subarachnoid space in the brain and spinal cord, and it's reabsorbed into the venous sinuses through arachnoid granulations. Here you can see we've got the ventricles, the lateral ventricles. This is a normal size. These are enlarged. This is what's called normal pressure hydrocephalus. So we've got too much CSF, but the pressure in the brain is normal. We typically see this in older adults. So we've got brain areas. So the cerebrum is made up of the frontal lobe. So this controls things like language, memory, problem solving, planning, emotions, judgment, impulse control, some sexual behavior, motor planning, execution. We've got the parietal lobe up here, language processing, recognition and orientation, sensory perception of stimuli. Then we've got the occipital lobe back here. This is vision, motion perception, color discrimination. Then here we've got the temporal lobe, which is speech, memory, and hearing. Cerebellum is down here. This has coordination of movement, balance, equilibrium, and muscle tone. Here's the brain stem. Basic life functions are from the brain stem, such as heartbeat, blood pressure, breathing. Also in the brain, not in this image, we've got the hypothalamus, regulation of autonomic nervous system, controlling functions such as vital signs, digestion, sweating, water metabolism. We've also got the pituitary gland, small gland at the base of the brain that secretes hormones such as TSH and GSH. Briefly going to go over some brain bleeds you might see on the floor. First, we've got the subarachnoid bleed. This is typically a hemorrhage from an aneurysm or a vascular malformation. In fact, 85% of subarachnoid bleeds are from aneurysms. They're diagnosed with a CT and history. Signs and symptoms might be the worst headache of someone's life, vomiting, photophobia, neck stiffness, loss of consciousness, and seizure. These patients are at risk of vasospasm. This is where cerebral vessels narrow. We're not completely sure why they do, but as precautions, we have decreased stimulation. We'll typically do vitals 1 to 2 hours or frequently to check for their blood pressure and other vitals to see if they are vasospasming. And we typically have them on nimodipine to improve their outcome. So again, subarachnoid hemorrhage is the hemorrhage where the CSF circulates. So as you can see, it's all throughout the subarachnoid space. All right, then we have a subdural bleed or hemorrhage. These are usually venous bleeds caused by a tearing of the bridging veins in the subdural space. They're classified as acute, subacute, or chronic depending on the time that's elapsed between injury and appearance of symptoms. Symptoms might be headache, pupillary changes, decrease in loss of consciousness, hemiparesis, and headache. You can see on the scan here, this is the bleed. This is also, you can see what we call midline shift. So you can see the middle of the brain has moved. And these are the lateral ventricles. You can see that this ventricle here is shrunken because it's been shifted over by the bleed. All right, then we have epidural hematoma or epidural hemorrhage. This occurs in less than 6% of major head traumas. Most of these are from arterial bleeds due to the location of the middle meningeal artery in the epidural space. These are frequently associated with temporal skull fractures. So classically, when you see these bleeds, there'll be a brief loss of consciousness, then a more of a lucid period, and then a rapidly declining level of consciousness. Also see headache, seizures, vomiting, and elevated intracranial pressure. So for subdural epidural bleeds, we'll typically see surgical drainage, often with a burr hole. For subacute and chronic hematomas, and typically a craniotomy for an acute subdural hematoma. Other bleeds that we'll see is intracerebral hemorrhage. So this is bleeding into the brain tissue. These are commonly below the surface of the cortex. We'll also see intraventricular hematoma. This typically occurs secondary to a traumatic SAH or an extension from an ICH. So as you can see here, this is the ventricle, and you can see blood in the ventricle. So this is an intraventricular hemorrhage.